Imagine you're home alone when suddenly your face goes numb, your arm won't lift, your speech becomes slurred. Do you recognize these as stroke symptoms? And more importantly, do you know what to do when there's no one there to help? The frightening truth is that stroke can happen anytime, anywhere, at work, on the street, in the supermarket, or right inside your own home. In the U.S., someone suffers a stroke every 40 seconds, and when it happens, every second counts. When blood flow to the brain stops, brain cells begin to die within minutes. Most stroke survival guides assume someone is nearby to call for help. But what if you're alone? Millions of people live alone, especially those over 60, the age group with the highest stroke risk. I've heard many terrifying stories from survivors. Some lost consciousness almost instantly, completely unable to call for help. Others had to crawl in pain and panic inch by inch, just to reach the phone. These aren't distant stories, they're reality. And today, I'll show you exactly what to do to save yourself if a stroke strikes when you're alone. Knowing how to recognize and respond to a stroke when you're alone can mean the difference between life and death. Have you ever experienced a stroke while alone? If so, how did you react? Please share your story in the comments below. Your experience might inspire and even save someone else's life. In this video, I'll show you 5 simple actions that could save your life if a stroke strikes and no one is around to help. You'll be surprised to learn how subtle some of the early symptoms are. Most people completely overlook them. I'll also reveal how your ordinary smartphone can become your most powerful survival tool, along with one simple yet counterintuitive body position, and a crucial technique that doctors always wish every patient knew. Pay close attention. Every minute could change everything. Step 5. Recognize the symptoms. Immediately, your brain is sending an SOS. The first and most critical factor for surviving a stroke when you're alone is recognizing, as early as possible, that you are having a stroke. But this isn't as simple as you might think. When a stroke begins, the brain becomes disoriented. Your thinking becomes foggy. A natural reaction for many is denial, or trying to explain the symptoms away to stay calm. I once heard someone share how they had a stroke at home and didn't even realize it. They even went back to bed. That delay may have caused millions of brain cells to suffer irreversible damage. The medical community uses the acronym FAST to quickly identify stroke. F. Face. Look in the mirror or use your phone's camera. Try to smile. Is one side of your face drooping? A. Arm. Extend both arms in front of you. Close your eyes and try to keep them steady for 5 seconds. Is one arm drifting downward? S. Speech. Say a simple sentence like, "The sky is blue today." Is your speech slurred or jumbled? Can you form the sentence properly? One viewer shared a heartbreaking story about their aunt who couldn't say a specific number while reading, a missed warning sign. Another stroke survivor recalled being unable to say a full sentence, even forgetting the word stroke. T. Time. If you notice any of these symptoms, time is critical. Every minute counts. In addition to FAST, watch for other warning signs. Many stroke survivors have shared experiencing these. Sudden numbness or weakness, especially on one side of the body, such as waking up to one side feeling paralyzed, or numbness running from the forehead down one side, as in some TIA cases. Sudden confusion or difficulty understanding. Sudden vision problems in one or both eyes. One viewer lost vision in one eye. Sudden dizziness, loss of balance or coordination problems. Sudden severe headache with no known cause. One survivor described an intense pain in the center of the head. Another thought it was a severe migraine. Difficulty sticking your tongue out straight. The difference between recognizing these signs and ignoring them could determine whether you get help in time. Don't wait to see if the symptoms go away. Strokes rarely resolve on their own without treatment, and hesitation only increases brain damage. If there's any doubt, act immediately. Step 4. call emergency services immediately. This is your lifeline. Once you recognize stroke symptoms, your absolute top priority is to get emergency medical help as quickly as possible. This might sound obvious, but it becomes far more complicated when you're actually experiencing a stroke. Call 911 in the U.S. immediately, even if your speech is affected. Emergency dispatchers are trained to recognize stroke symptoms. Say the word stroke if you can, but even if your speech is slurred or unclear, stay on the line. Many emergency systems can track your location even if you cannot communicate. If you can't reach your phone or dial, use your smartphone's voice assistant. Hey Siri, call 911, or OK Google, call 911. This is critical. Several stroke survivors reported being unable to dial or type. Press your phone's emergency buttons. On many devices, quickly pressing the power button several times will trigger an emergency call. Call 911 even if your phone seems to have low battery. Always keep your phone charged. Use any medical alert devices you have, like Life Alert. Use a smart speaker if available. Alexa, call for help. Bang on walls or floors if you live in an apartment or shared building to alert neighbors. When connected to emergency services, communicate as clearly as possible. Say you believe you're having a stroke, provide your location, and mention if your door is locked. Paramedics may need to break in. Describe your symptoms and when they began. Choosing the hospital. This can significantly impact your outcome. If possible, request transport to a designated stroke center. These specialized facilities have protocols and equipment specifically for rapid stroke treatment. Some ambulance services may bypass closer hospitals to take you to a stroke center if your condition allows. Step 3. Position yourself safely while waiting. Protect yourself from further harm. The way you position yourself while waiting for emergency services can greatly impact your condition. The goal is to minimize complications and prevent additional injury. Many people express concern about how much they can physically do during a stroke, and this concern is valid. You should only attempt actions you can safely control after calling for help. Lie on your side. If you feel weak or dizzy, both common stroke symptoms, lie down on your side rather than standing or sitting. This reduces your risk of falling and injuring yourself further. The recovery position, lying on your side with your upper leg bent and your lower arm supporting your head, is ideal, as it helps keep your airway clear. Keep your head slightly elevated if possible. A small pillow or cushion can help. This may reduce pressure in the brain for certain types of strokes. A helpful tip: if you can, lie in an unusual location where family or friends wouldn't expect to find you. For example, on the hallway floor rather than on the bed or sofa. This can immediately signal to others that something is wrong. Avoid eating or drinking anything while waiting. A stroke can affect your ability to swallow properly, increasing your risk of choking. Additionally, some emergency stroke treatments cannot be performed if you've recently eaten. Loosen any tight clothing. Loosen tight collars, belts, or anything restrictive around your neck, chest, or waist that could affect breathing or circulation. As one viewer rightly suggested, if you're wearing dentures, remove them to avoid choking risks. Stay warm, but avoid overheating. A stroke can disrupt your body's ability to regulate temperature. Keep yourself comfortable with light coverings, but avoid heavy blankets that may cause overheating. Try to stay calm. We know this is easier said than done, but panic and anxiety can raise blood pressure and potentially worsen stroke damage. Focus on slow, steady breathing. Step 2. Make it easy for others to reach you and prepare for assistance. Every minute saved protects brain cells. After calling emergency services, if you're physically able, your next task is to ensure that help can reach you quickly and efficiently. This crucial step is often overlooked in moments of panic, but can prevent serious delays. Once again, only attempt these actions if you can do so safely, without delaying your emergency call or putting yourself at further risk. Unlock doors if possible. Paramedics may have to break down locked doors, wasting precious minutes that could save your brain. If you live in a secured building with multiple access points, try to move toward the main entrance if you can safely do so, if you're in a remote area or somewhere not easily visible from the street. Find ways to make your location obvious. Turn on exterior lights, open curtains. Position yourself somewhere. First responders can easily see you, near the front door or in a main room. Gather essential medical information, if possible. One viewer shared they kept a medical information card in their wallet, an excellent proactive step. If you can, prepare a list of your current medications, your medical history, especially conditions like high blood pressure or previous strokes. Contact details for your doctor and emergency contacts. Create a safe environment while waiting. If possible, clear a pathway to your location by moving furniture or obstacles that could block medical equipment. Some stroke survivors found this step difficult during an active stroke, so only do this if it's truly feasible and quick. Turn off the stove or other hazardous appliances if symptoms start while cooking. If you have pets, confine them to another room to prevent interference. These preparations may seem minor, but they can significantly reduce delays when help arrives. Remember, in a stroke, every minute matters. A few simple actions can save vital time and brain function. Step 1. Record your symptoms and their progression. This information is gold for doctors. This is a step that one viewer said truly shook them, realizing how critically important this information is. Documenting the exact time your symptoms began and how they progressed provides invaluable insight for healthcare providers, especially if you can do this while waiting for help or immediately after noticing the first signs. The precise onset time of your symptoms is one of the most critical details doctors need. Some life-saving stroke treatments, such as clot-busting medication, TPA, or mechanical clot removal for ischemic strokes, must be administered within strict time windows from when symptoms started. If you're able, record the exact time you first noticed your symptoms. This information can determine which treatments are available to you. If writing is difficult, use your phone to record a voice memo describing the exact time your symptoms began, what you experienced first, how the symptoms progressed or changed, any actions you've taken or medications taken recently. If possible and you're still alert, set a repeating alarm on your phone to sound every few minutes. This helps prevent unnoticed loss of consciousness and serves as a safety net if you lose the ability to call for help again. In addition to timing, pay attention to whether symptoms are getting worse, staying the same, rarely, improving. This information helps doctors assess what is happening in your brain and decide on the next steps. Also note any recent medications, especially blood thinners, pain medications, blood pressure medications. These details can significantly impact your treatment plan once you arrive at the hospital. The specifics you document in this emergency can dramatically influence your care and outcomes.